This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Welcome, guys. First, I just want to say, congratulations for making it to this stage. It's a really exciting time for you guys. So hopefully you guys have some fun with it. But my name is Aaron Lee. I'm one of the PGY4s, and
I'm Dan Decker. I'm also one of the PGY4s.
And so without further ado, let's talk a little bit about our program.
So who are we? We are Geisinger PM&R. We're a 4-year categorical program with the built-in transitional year. We currently have 3 residents per year, but we do have funding for a 4th resident, so we're working on that. We're contracted with Encompass Health, which is one of the nation's largest system of inpatient rehab hospitals. So pretty much you work here and you can work at any of those Encompasses throughout the United States. We're a nonprofit health service organization that provides service to 3 million residents in PA. We're a tertiary care center with level 1 trauma, located in Danville, Pennsylvania, with 10 hospital locations with many community clinics.
Tertiary.
And here's just a map with the overview of kind of all the hospitals that we work at.
Yeah, huge catchment area with 3 million patients.
So here's our leadership. We got our program director, Ryan Rosa. He graduated from UPenn, and then he's got a sports medicine fellowship from Geisinger. And then we have Dr. Chun Ho, who did his residency at JFK, and then our program coordinator, Eric Weaver. Here's just our faculty. We got an EMG specialist, Dr. An. I don't have to go through all these names, but we also have a pediatric sports medicine guy, Jeffrey Summers, who works with us and does some MMT, which we'll talk about later. And here's kind of just all the different schools that they graduated from. And here's a list of our current residents. You can see me and Aaron at PGY4. And again, we have four classes because our PGY1 is part of our transitional year. So they're with us. And here's just some pictures of us together. It's a little embarrassing.
Some fun events like, our wellness events, our holiday parties, our cookouts, and everything like that.
And then there's just pictures of didactics. There, I think we're doing some manual MMTs. And then our bottoms are ultrasound curriculum. And here's just some pictures from our presentations that we presented at. And then I think that's, again, our ultrasound curriculum lab, where we also, not only will we do ultrasounding on each other, but we'll have cadavers and we'll work on injections and stuff like that in the cadavers. And training locations, obviously, Geisinger and Encompass, we just talked about it in Danville. We have Geisinger Medical Center, which is also the big main hub hospital for Geisinger. And then we work at the VA. Bloomsburg is where we do our intern year. Then Woodbine and Bloomsburg is where we do our outpatient rotations for our clinics. And here's just a picture of Encompass Rehab in the gym. That's actually where we're at right now.
Right behind us.
Yep. And here's a picture of GMC. This is the big house. This is the main hub hospital for Geisinger, located in Danville as well. And again, we do consults here. We do our neuro inpatient during our intern year. We have brain injury clinic, EMGs. So we're here a lot. And this is Woodbine. This is where Dr. Rosa works, and we do our sports medicine rotation. And then we also do interventional pain as well at this place. And this is Bloomsburg. This is where we do pretty much most of our 90% of our rotations our intern year here. And lastly, we got the good old VA at Wilkes-Barre. And here we do
Pain.
yeah, just pain. We don't do initially an ICU rotation here intern year, but we got rid of that. So some benefits, we get all these textbooks included, Lisa's Bradham's, obviously Cucurilla. They'll cover step 3 as well as UWorld as well for when you're studying for step 3. You get annual memberships to PM&R, AAP, ANAM. And then obviously we have some wellness days. We have 2 half days scheduled throughout the year, but then we also do things as a group together that are kind of off the cuff. Yeah, we have a mentor mentee program where you kind of get matched up with a third year gets matched up with the first year. So you kind of can always have them to reach out to if you had any questions. And then obviously CME money. We do get access to PM&R recap and ultrasound guidance, which I think we talk about on the next slide here.
Yeah, you get $750 for CME the first year, and then $2,500 for PGY 2s through 4s.
So yeah, like I said, Dr. D'Angelo used to be with us. Unfortunately, he recently just left, but he still gives us access during our 4 years here to PM&R recap and ultrasound guidance, which are these 2 awesome websites that he made. If you guys haven't heard of PM&R recap, you definitely should check it out.
Yeah, it's like the Pathoma for PM&R.
Yeah, that's a good description. So vacation CME, we get 5 CME days for PGY2 and through 4, 15 vacation days per year. When you do your conferences, you get you obviously get to use your CME money then, and we also get, I think it was like $30 a day for meals while you're there.
70.
70. Oh,
yep.
Whoops, way off on that. Here's our salaries. You can see PGY1 starts at 65,000, and then you can kind of read the rest down to PGY4 where we're getting 72, 839. However, that just continues to go up every year. And then another nice opportunity is we get to do moonlighting. So once you can initially kind of shadow one of our physicians at a high school football game or even some college football games, and then if you feel more confident, you can go on your own and then you get paid for moonlighting, 70 an hour. So that's pretty nice. For moving, you get $750 for reimbursement for moving expenses. Again, we talked about the books for PGY 1 year, and then like you said, you get $2,500 for PGY 2 and up, and then you get Geisinger's insurance,
which includes dental, life insurance, disability, vision, and all that. All right, a little bit about our curriculum, and we do include our interns here. So you do get, 4 rounds of didactics, and so you get a lot of repetition here. So it is, it's a 12-month schedule. It is every Wednesday. It is protected time, which means you don't answer any calls. All the attendings take care of that, which is super nice. We get guest speakers from their respective specialties so that we have experts talking about their field. We have workshops such as EMG and ultrasound, board review, journal clubs, grand rounds, and M&Ms. And we also have cadaver dissections with ortho as well. Our dedicated ultrasound curriculum, so that's once a month, and it's 4 hours of just ultrasound related lectures. That includes anatomy, physical exam, pathology, and a lot of hands-on time for the staff to kind of guide you on looking at the anatomical structures and specific techniques to make your ultrasounding a little bit better. And the machines are available on the weekends. We do rent out butterflies as well as part of our department, and as part of our program, you can test for the RMSK at the end of your 4 years, which is the certification that you need to bill for ultrasound when you're in the real world. A little bit about our rotation. So again, they're mostly at Geisinger Bloomsburg Hospital as well as the main hospital, and you do have 1 rotation at the VA as well. So you have 2 EM, 2 IM, 1 inpatient psych, 1 outpatient neurology, 1 inpatient neurology. And then what's nice is that at the end of your first year, you do have kind of an intro to inpatient rehab where you're just kind of shadowing the PGY2s and kind of getting your foot wet. And then outpatient rotations include urology, neurology, peds, sports med, and gen surg as well. All these, help you become a better rehab doctor. And then the PGY 2 through 4 rotations. So these are kind of the sample rotations that we have. So it's 12 months of inpatient in total, and we do have junior and senior roles, and that's to kind of facilitate your transition into the real world. Once again, when you're, PGY 2 or 3, you get acclimated to doing, the notes, the physical exams, and, kind of the medicine part of it. But when you're, out in the real world, you need to know how to do teams, how to do basically finagle your way through the system. And that's kind of a lot of the stuff that you learn as a senior, and less, medical stuff. And then we have 7 months of outpatient, 4 months of sports medicine, 2 months of interventional pain, and also 4 months of electives, which is a lot. And then 3 months of EMG to close it all out. As for the call schedule, so you do have no call first year, which is amazing. Then 7 weeks in the second year, 7 weeks in the third year, and 2 weeks in fourth year. It is home call, which is super nice. And it's from 7 Friday to 7 a.m. The next Friday. And you will be rounding on all the patients on the weekends. And here we have we use Epic at Geisinger. We also use Cerner here at Encompass, and we also use Tiger Connect as our pagers. So you do have to have a phone here. And then we are part of the Musculoskeletal Institute, which allows us to pull kind of our resources together with ortho and allow us to do more research and have more opportunities as well. And most of our residents do speak at conferences such as AAPM&R, AAP, AMSSM. You get additional money if you are like a podium speaker, which is super nice. And I would say, this program is really, good at outpatient. And one of the special things about this program is that you do have a D1, D2, D3, and high school level sports medicine coverage, was super nice. So you can, work your way through all the levels and have experience at the high top level as well. So these are some of the other schools that we cover. We do cover, Bucknell, which is D1. We do cover semi-pro, which is the Wilkes-Barre Penguins and the Rail Riders, and a couple universities around here as well. Another super cool thing about our program is the tracks. Again, we kind of get you ready for the real world. So we do have these kind of funnels that we put you in according to your interests. And, there's sports medicine, there's pain, there's peds rehab, there's inpatient, and we can make more tracks according to, what you guys want to do. And we do have in-house sports medicine fellowships. We actually have 2 of them. There's 1 fellow per year at Danville, and then there's 2 fellows per year in the Wilkes-Barre area. And we have accepted PM&R residents in the past, and it is ortho-based. It is coverage heavy and definitely ultrasound heavy as well. So, it's not all, work. We do kind of focus on resident wellness here. Dr. Rose, our program director, is super into wellness, really cares about our well-being. So we definitely do have, multiple outings a year. He even invites us to his house. We have Christmas parties, we have cookouts, and definitely a lot of extracurricular activities. A little bit about housing. So Danville is a cheap place to live, which is super nice. I would say, besides all the regular, websites that you need to use to get housing, you can use this special Geisinger website. It's called ResOx, and you can pass the get current resident housing passed on to you, which is super nice.
Just a quick time check that y'all have 5 minutes remaining.
Sounds good. Thank you. So local attractions, there's definitely a lot of outdoor stuff to do here. Here we have Ricketts Glen Park, another picture of Ricketts Glen, and we definitely do have all the seasons here. It's super pretty during fall here. Some more attractions. So we have like, I think 5 ski mountains within an hour of us. And we definitely have a lot of outdoorsy stuff to do, camping, And then there's definitely how many, like five golf courses? Yeah, 5 golf courses within 40 minutes of us. There's one right in town. Yeah, there's one right in town, and actually you get a discount as a resident. It's only $500 a year to join the clubhouse there. And obviously a lot of farmers markets here. If you're into the gym, there's like 3 gyms in town actually, and definitely a lot of facilities because there's tons of local schools here. Now being in, central Pennsylvania, it is only a 3.5 to 2.5 to 3.5 hour drive to a lot of metropolitan places. I mean, New York's 2.5. State College for football is only 1. Philadelphia 2.5. DC 3.5. So a lot of metropolitan places really close to here. And I would say, just in closing, what really differentiates us is our staff. They're super hands-on, super approachable. I've definitely been in situations where, as a resident, you're uncomfortable in handling, and definitely every single one of those times, my attendings had my back, and that's super comforting to experience. I would say we are a very procedural program. Our strength is our outpatient, and so, we get a lot of procedures. More on that in the next slide. And I would say we have strong sports medicine fellowship, as well as a strong ultrasound curriculum. And I think the mentor-mentee program is super nice because you do get paired up with a senior, but you also get paired up with an attending that kind of guides you through your experience here. And then again, the tracks is super nice because it kind of gets you ready for what you want to do specifically to, your interests. And then also, research here, and obviously camaraderie amongst the residents. Here's just the ACGME procedural requirements for all PM&R residencies. And I would say, I probably hit this by everything except for EMG by the end of 2nd year. So again, we're super procedural heavy. And there is our contact information. I'm happy to throw in my email as well for any that needs it. All right, I'll leave some time for questions if we have enough time. Oh, okay. I think we have to hit the chat. Having trouble pulling up the chat right now.
Team chat, there's. Oh, maybe not.
Are there questions in the chat?
It doesn't look like we have any yet. Oh, there's one.
Oh, gotcha. Okay. Can you join a track later on if you're not selling any subspecialties, or do you have to decide on that early on? Yeah, no, definitely. It's not like a specific time you have to join. You don't have to join as a PGY1. Those are just to kind of guide you through your interests and kind of get you on track for where you want to be. You can join them at any time. You can leave them. Doesn't really matter. It's just to give you more information about, things that you want to do and get you answers to the questions that you have. When you're on call, how many beds are you on call? And does that vary between inpatient? Okay. No, it does not vary between inpatient brain injury or general. We have about, I think max is 38 beds, but I would say typically round on about 28 patients.